Hi, I am Dr. Tanmoy Mandal, a medical oncologist attached to the Manipal Hospital's Broadway. So today we will be discussing something about immunotherapy. So what is immunotherapy to specify? So immunotherapy is a type of systemic therapy which is used in cancer patients. First and foremost question which we need to answer is that does immunotherapy have a role in all cancers? No, it's not. It doesn't have a role in all cancers. There are some cancers where immunotherapy works better as on date. Hope in future we may have more and more amount of immunotherapy which might expand the role of immunotherapy in almost all the cancers. But as on date, all cancers are not sensitive to immunotherapy. So how does immunotherapy act? So in common language or in basic language, what we want to say that immunotherapy acts in a special way. These cancer cells have immune expression. They have some special expression which are immunogenic. So these immune expressions are known as programmed death ligand receptor 1 or programmed death receptor. PD receptors or the programmed death ligand receptor, PDL or PD receptors. So these are expressed in the cancer immune cells. So if we target these cancer immune cells, this leads to a better cell kill, this leads to a better outcome. So basically it's also a type of targeted therapy which targets the cancer immune cells. Benefits which we see: less amount of side effects, less normal cell kill, better survival advantage. So these are the benefits in comparison to a conventional chemotherapy. In many cases, we see that these have outperformed in regard to the common chemotherapy in many ways. What are the cancers where immunotherapy has a very great role? One of them is the lung cancer, where it has a very good role. One of them is the kidney cancers or the renal cell carcinomas, where it has a very good role. In breast cancers, in endometrial cancers, in cervical cancers, in head and neck cancers, all of these we see that there are very great role of immunotherapy in these ones. So these are the advantages, these are the indications where immunotherapy can be used. And point to remember, all cancers are not sensitive to immunotherapy drugs, and it's in specific stage, in specific line where the immunotherapy works better. It's not that all patients who are newcomers are prone to be highly sensitive to immunotherapy. This is not the true. Thank you.